Hi everyone, my name is Brett and welcome to the special walkthrough of NexaPoint Health where innovation meets patient care. Let's begin by logging in as a medical assistant. For this demonstration, I'll walk you through the process of handling a visit for an established patient arriving at the clinic for an in-person appointment. As we go through each steps, I highlight how NexaPoint Health enhances efficiency, improves patient engagement, and supports providers with intelligent automation all in one unified platform. From the dashboard, we click on Patient, select the patient you wish to have an appointment, for example, Maria Thompson, then click on Book Appointment. Then click Next. Under Chief Complaint section, we are prompted to chat with Mia, our built-in AI assistant. This features allows the patient to briefly describe the reason for their visit. But as a medical assistant, you do have an option to skip this part by clicking on the skip button. But let me show you how Mia works. The Mia provides a personalized response based on that input, a unique features that support autonomous appointment booking even without a staff involvement. This is also valuable for clinics aiming to offer 24/7 self-service access to patient care. Once Mia gathers the necessary information, she will guide the patient through selecting the suitable date and time for the visit. Let's enter the reason, chest pain, encounter type, established patient, select available time. For payment information, let's say that this is an insurance payment and there will be a $20 copay. Then click Book Appointment. Once the appointment is successfully scheduled, we can view the details by clicking on the Details button. Here you will find patient's information, patient's history, patient's complaint generated by Mia, the AI. You can also see here patient's vital signs, upload lab results, can add charges as well, and also have an option to cancel or reschedule the appointment. Let's now click Patient Encounter tab. You will see an option to select an in-person meeting and a button to start dictation. Once clicked, the system begins recording the live conversation between the patient and the medical assistant. This voice capturing capability is another smart feature of NexaPoint Health designed to allow the staff and the provider to focus on care while allowing the documentation in the background. Let's click on Start Dictation. You will notice the microphone icon turns blue, indicating an active recording. While the session is recording, the medical assistant can continue updating the patient's history and entering vital signs. At this point, let me play a voice recording and let's assume that this is the patient and the medical assistant interaction. Good morning. I'm Brett, your medical assistant for today. Can you confirm your full name and date of birth?
Sure, it's Maria Thompson, date of birth January 12, 1982.
Great, thank you. Let's start by reviewing your reason for today's visit. What brings you in?
I've been having chest pain, mostly in the evenings, and it sometimes spread to my left arm.
Got it. When did the chest pain start and how would you describe it?
It started 4 days ago. It feels dull and pressure like, not sharp. It usually lasts about 15 to 20 minutes.
Any personal medical history we should note?
I have high blood pressure and mild asthma.
Any surgeries in the past?
Just my appendix removed when I was a teenager.
Have you ever been pregnant?
Yes, two pregnancies, both normal deliveries.
Got it. Any known allergies to food or medication?
Penicillin, I get hives when I take it.
Do you or your family have history of heart conditions?
My dad had a heart attack in his early 50s.
Do you smoke, drink alcohol, or use any recreational drugs?
I don't smoke. I drink wine occasionally, maybe 1 to 2 times a week.
Got it. Let's check your vital signs. Your blood pressure is 145 over 88. Your heart rate is 88 beats per minute. Your respiratory rate is 16. Your oxygen saturation is 99%. Your temperature is 98.7 Fahrenheit. I'll also upload your recent labs result. Your cholesterol came back high. Your LDL is at 160. Flag that for the doctor. So all done. I'll now transfer your encounter to the provider. Please wait a moment while the doctor reviews your intake.
Once the assessment is complete, we simply click on transfer and click yes. Then the system automatically sends the encounter to the assigned providers. And let's change the rooming status from confirmed to room, which means that the patient is now ready to be seen. The system will generate a summary of the visit. This is also powered with an AI and also provides a full transcription of the conversation for review and documentation purposes. So, this ends our medical assistant workflow. Now, let's log in as a provider. Upon logging in, I'm immediately presented with today's schedule. As you can see, a notification has appeared indicating that the medical assistant has completed their portion and the patient is now ready to be seen. When I click on the notification, I am taken directly to the in person encounter screen. Before starting the consultation, I can review the medical assistant AI generated summary along with a full transcription of the recorded conversation with the patient. This provides me with a clear, structured overview of the patient's current complaint and history, all prepared before I'll join the meeting. Now let's go ahead and join the meeting and click on Patient Encounter and click on Join Dictation. Additionally, I can select a template category based on the visit type. For example, chest pain, and search the keyword. And the system instantly provides a suggested clinical prompts. This unique features is incredibly helpful for providers, especially those managing a high patient volume, as it ensures that all relevant questions are addressed without having to rely solely on memory or manual intake. At this point, let me play a voice recording again and let's assume that this is the patient and the medical assistant interaction.
Good morning. I'm Dr. Brett. What brings you in today?
Good morning, doctor. I've been having a persistent chest pain over the past few days. It's dull and sometimes radiates my left shoulder.
I see. Let's talk more about that. When did this chest pain start?
About 4 days ago, it usually comes on in the evening and lasts around 20 minutes. It gets a bit worse when I'm walking or climbing stairs.
Do you have any cardiovascular risk factors like high blood pressure, diabetes, or high cholesterol?
I have high blood pressure and I was told that my cholesterol was borderline last year. No diabetes though.
How about your family? Any history of heart disease?
Yes, my father had a attack in his early 50s.
Are you allergic to any medications or food?
I'm allergic to penicillin. It gives me hives.
Any histories or surgeries or hospitalization?
I had an appendectomy when I was 12.
Any medical conditions beside hypertension?
I also have seasonal allergies and that's about it.
Okay, have you ever been pregnant?
Yes, I have two kids. Both were full term normal deliveries.
Do you drink, smoke, or use recreational drugs?
I don't smoke or do drugs, but I do have a glass of wine a few times a week.
Okay, so let's do your physical exam. Let's check your vital signs and do a quick exam. Your blood pressure is 145 over 88. Your heart rate is 88. Your temperature is 98.7 Fahrenheit. Your respiratory rate is 16. Your oxygen saturation is 99%. So your heart sounds are regular with no murmur. Lungs are clear, no tenderness over the chest wall, and no leg swelling. I can also see here that your recent labs are back. Your total cholesterol is 230 mg per dl. Your LDL is 160. Your HDL is 42. Your blood glucose and troponin are normal. ECG shows non-specific T wave changes. So based on your symptoms, physical exams, and lab results, my assessment is likely angina pectoris, a stable type. Your elevated LDL and history and family history are quite concerning. So I'm recommending a cardiology referral for further evaluation and a possible stress test. So right now, I'll recommend you start on taking atorvastatin 20 milligram daily. Continue taking your antihypertensive medication. I would also schedule a cardiology referral, and I'll also recommend a lifestyle changes. Start with low fat diet and regular exercise. Also, avoid exertion until cleared by your cardiology. I'd also like to see you again in 2 weeks to check your progress and labs updates. If chest pain worsen or becomes severe, please go to the ER immediately.
Right now, let's prescribe a medication and send it to the patient's preferred pharmacy. Let's click on e-prescribe and click on create new RX and search for the medication and enter the strength. Under patient's direction, you can click on this drop-down menu and select the patient's direction. Then it auto-populates patient direction. You can also add additional notes to the pharmacist. Once done, click on review. After reviewing the prescription, let's click on save pending RX and click close. Right now, let's send the prescribed medication to patient's preferred pharmacy. Let's click on pending RX and enter the signature password and click send. Now, the medication has successfully sent to the patient's preferred pharmacy. Let's now go ahead and click close. At this point, let's send a referral to the cardiologist. Let's click on referrals tab and enter the physician's information. After entering the physician information, let's click on submit. A pop-up window will appear asking you to review the referral form. After reviewing the referral form, click on send fax. Then the cardiologist will automatically receive a notification about the referral. The referral has been successfully sent to the cardiologist. Right now, let's click on patient encounter. Once the consultation is complete, I simply click on checkout and click yes. The system then automatically generates a progress note combining input from both medical assistant and a provider powered by an AI. The system now done generating the progress note. You can also see here medical assistant summary as well as the full transcription of the visit. You can also see here patient's vital sign, chief complaint, which is also powered by an AI, history of present illness, patient's cardiovascular risk, family history, patient's allergies, patient's past pregnancies, as well as patient's past surgery, and also system also captures the physical exam that was conducted during the visit, as well as the lab result. And also, I would like you to appreciate this. The system suggests an ICD-10 code based on the documented assessment. And the option to select the billing codes, just click on this drop-down menu, categorized by visit, duration, and complexity. For example, 30 minutes. After reviewing and confirming the documentation on the progress notes, I can complete the appointment by simply click on complete appointment. And I also have an option to download into PDF. So let's now click on complete appointment and click yes. The final notes are neatly formatted and ready to copy paste directly to your existing electronic medical record system. Once today's appointment is completed, the provider may proceed to the billing section to submit the claim. Let's click on your profile and click billing, then click submit. The claim will automatically transfer to the billing AA portal, which will handle the final submission to the clearinghouse. In the event of any denials, the billing AI will identify the issue and make the necessary correction and resubmit the claims on your behalf. So this completes the provider's workflow. As you can see, NexaPoint Health is designed to streamline every steps of patient's journey from intake to documentation to billing while allowing the providers to stay focused on what really matters most, which is delivering an exceptional care. Thank you.